These are not real clear colors, but it looks like you have orange or yellow in the middle here around your pupil. That could be sulfur. These are just, the coloration is not good enough for me to tell, but the way it looks is you've got a lot of sulfur in you. It means you got a lot of candida problems. You're having lymphatic stagnation problems. I get up to your upper femur, your right femur. You got a weakness I can't see, but it looks like a right knee as well. I'm looking at the hip, the right hip. You're going to feel that, but your family's got the kidneys, the lower back, the hips, the knees. You can tell that you're losing those. They've been losing those tissues, and if this is a parathyroid gland, it shows the inability to repair that. Now, there's a tad bit of pancreatic weakness and also gallbladder here going on. So you might want to get into those tissues and clean up the gallbladder and liver. Definitely the lymph is stagnant in the gallbladder and liver and pancreatic tissue. Your lower rib here got a weakness here. I'm up here, I'm either up here in this upper lobe, up here in this lung here. You got some weaknesses. It might even take up this right shoulder. With that said, when I get up into the cerebellum here, you've got some weaknesses, could yield you some equilibrium problems and dizzy, vertigo problems. Also, I see a little pineal gland, which could give you insomnia and stuff, but you really got to clean your lymph system out. Your skin is weak. You really got to clean your lymph system out. Your back is definitely giving you some problems right now. On the left side of your body here, a better kidney for sure. Upper femur again, a lot of inflammation in the knee and below. Groin on this side, got a lot of lymph stagnation in this groin area here. The left hip is an issue and the left testicle is an issue. Also, if I go up to your spleen, I find a little genetics in the spleen area. Lower lobe of this lung, got a spot in it here. You want to get in the lungs and clean them up. Maybe even a little tad in this upper lobe. Get those bronchial trunks cleaned out. With that said, I'm picking up a right shoulder, a lot of congestion in this ear here. Pituitary, a little bit of pituitary going on there. Swing around, tonsils, not real happy if you still got them. A little bit of thyroid on this side, better parathyroid. Throat, you're going to have a sore throat during a detoxification. Your hips are going to hurt and your knees are going to hurt. I can pre-warn you with that. You got upper either T or C spine weakness on the left side here. As I get in, you got a little rectal wall, a little prostate, and a little bladder going on here. So it sounds like a lot, but all in all, you know, you're pretty good here. Tell you the truth, you really need to move your lymph real bad. You're malabsorbed. You got to get your lymph clean, your bowels cleaned up. You get your kidneys online better. Start working on your skeletal system, but you got to move your lymph better. I'd clean out my lungs as well. I can tell you that would be a good idea. Use the lung formula. At one time, use the pancreatic capsules and liver capsules. You can alternate between the two. Pick up, you know, just strengthen that gallbladder and the pancreas. But move your lymph, more important than anything. Right kidney, you might even feel this right kidney when you're detoxifying. I have no doubt that you're going to feel your back there. So that's what you can see in an eye. Those things is what you can see in an eye. And you couldn't have an MRI or CAT scan and see those things. So, but I'll set up something here if you want to send in your eye pictures like Tim did, and we'll set up, and I'll do a quickie for so much, and it'll make me a little bit of money to sit down and do these. But I don't have a lot of time in my life as it is. But having your eyes read is really an incredible thing. I'm going to teach you how to read them. Okay, so I don't know when I'm going to get to that, but I will. I promise I'll get to that. I'm definitely going to have a day of it in my class. And I make it real simple. I'm one of those guys that cuts to the chase. I'll show you how to trim off the fat. Here's how you see them, and I'll show you things they don't know yet in iridology here. All right, Tim, go for it, man. Now, this is 78. This is mother is 78. She has bad knees and ankles. Now, how would you get bad knees and ankles? What's going on? You guys are right. It's your kidneys. And what's on top of the kidneys? The adrenal glands. So she's in 78, of course, a typical person, not going to have good kidneys, and so bye-bye knees and ankles. But I'm telling you, the hips are going too. You know, when I worked in the ER, we used to have a lot of fractures down here since it's the senior citizen state. I used to ask these little old ladies that come in with broken hips, supposedly fell in the bathroom. I say, "Did you hear a crack before you fell, honey?" you know, these people just have so much calcium sucked out of them because they're just one big acid. No one helps them to understand that you can't eat this way anymore. You can't. And where man is in his cellular morphology or his cellular weaknesses, we cannot follow the same diet anymore. We cannot do that. We cannot follow these protein diets. Just can't do it anymore. We're already ravaged of calcium as it is. And to go on a protein diet ravages the body of more calcium. Just can't do it. Contraindicative. Cartilage is gone, bone on bone. Ew. She's had one knee replacement, and her one foot is completely pronated with osteoarthritis. Well, I mean, she's pulling out calcium. Remember, when you're acidic, your body has to fight these acids. So remember, acids win, you lose. And so what's happening is her body's pulling this calcium out of the joints. She's losing her joints, and she's getting bone spurs all over the place. I mean, that's, and then, of course, a lot of pain because that's acidosis in those tissues, and that's how we all go. She refuses to change her diet and relies on aspirin for pain. I've heard you can say with people at that age, it's hard to get them da-da-da-da-da. Yes, yes, yes. Can you please suggest any herbal tonics that may help ease some of her pain? Well, again, if she's willing to take something, these tinctures are pretty darn strong, and so sometimes I go, ugh. But inflammation joints, if you're going to give her some tinctures, you're going to go kidneys, lymphatics, inflammation joints, so you could do the pain, but really she could get so bad that you need to give her aspirin because you're already on it. But really you want to get her on at least the lymphatic formulas, lymphatic 4, a couple kidney formulas, obviously at her age, hit her adrenal glands at this age, at least those. Probably want to give her some upper circuit, brain and nerve to keep her from ending up, with more problems. And this is a beautiful princess. I'll use that word there. I love you too, sweetheart. To the Sea Princess. Sometimes I can't read these things. I apologize here. I've got bad lighting, and I've been reading all day. She says taking the heal-all caps. Okay, now this was important. This is why I stuck this up here. She started taking the heal-all caps about a week ago. Today I woke up with swollen lymph nodes on my neck and ears, also some pimples behind ear where lymph nodes are located. Face has some breakouts too, but the skin is super soft now. My tongue is coated and I have chills today. Frequent elimination. Have been pushing fluids and have been to the bathroom frequently today. This healing crisis crept, you're right, honey, it's a healing crisis, crept up me. Should I do anything? I'm hoping this doesn't keep up long. I know, I hate healing crises, don't you? I do. I feel for you, sweetheart. Also, bad underarm smell, lymph nodes again. You guys are right on. Was eating all raw fruits and veggies for quite some time and did not experience any symptoms such as this. I started the heal-all caps. I love that tea. Don't you love those heal-all tea? Strong, aren't they? I love herbs. I just love them. And you're seeing the power, the difference between the foods and the herbs. You add the herbs with the raw, wham! I love that. So, I know you probably don't like that, but it also is saying, because there's not a lot of lymph power in that formula, at least not much, but obviously enough. So, it is suggestive, though, that your kidneys are at a big issue here. That you're not filtering that lymph, and you're seeing your lymph nodes swell. And so, I'd really focus on those kidneys and adrenal glands, sweetheart. You're of the age that you're going to be beat up with them genetically a little bit, so really focus on your kidneys and adrenals. Move that lymph a little bit. If you move lymph too aggressively, remember the lymph nodes can swell, so I want you all to keep that in mind, that if you're working with someone and their lymph nodes start swelling a little bit, back down on the lymphatic formulas. And the same thing with tumors. It's not a sin for a tumor to grow. But if you're working with someone, it could be indicative, that their kidneys are not filtering. And also indicative of the fact that the person has not got to those areas where you can move that lymph out. If you can't get the lymph draining and moving to an area that's in trouble, that area will continue to be in trouble. There's just nothing, you have to get to that area. You have to get to the place you're going. I also wanted to mention I got my tonsils out, when I was about 22 years old, and they removed their tonsils. What a wacko. And I am now 25. Yeah, sorry, sweetheart. It happened during the military. Oh, I love the military. I never did do well in the military. I don't like someone in my face. No offense, but you know what? I mean, we need to have peace, not war. But I am kind of a hippie guy, aren't I? Yeah, well, I'll show you a picture of me back in the 70s, but I had a big beard, my hair was down here, but I was a fruitarian living in the woods. I think this might be, no, this is from someone else. And they started the Heal All tea for 5 days, and the 4th day, and today I'm having flu-like symptoms. I love that tea. I just love that tea. You know, I must have been a traveling snake oil salesman or something, but I tell you what, when you get a good formula like that, I just love that formula. I love my formulas. And, I mean, try the difference. Try other people's formulas and play around with them. You know, you'll see the power there. But I think you're making it too strong. You're mixing 1 teaspoon for 2 cups of boiled water. My friend, I would probably go down to 1 teaspoon for 4 cups of water, maybe. Maybe you thin it up a little bit. Generally, at this level's for douching and colorectal cancer and mouth cancers and abscesses, real strong. You know, because you're converting cells fast. Butt's kicking your butt, and but that's a good thing. Break it down a little bit and make it more gentle. You're now in a pretty good healing, starting a good healing crisis. So kick up the fruit. You can slow this down if you want. Thin it out a little bit. And when will they stop? Well, I tell you, when you're in a healing crisis, you got cold and flus, and you're really running your nose, go as much as you can, because when it clears, your sense of smell and taste and awareness really goes way up. You don't want to just go and get a little bit out and okay, because you'll revisit it again. So really go and just realize that when you're going through it, boy, that's good to get that stuff out. Oh, yeah, that was good. You know, look at it, the positive side, and work through these. You guys want to detox. That's what it's about. Can't say I haven't been through a lot of those. Dr. Morse takes on this freaky disease called, I've already covered that. Morgellons. It is freaky. But she was pulling these blue hairs out, and there's always that little parasite attached. Oh, I had vials of stuff in here from this one lady I was telling you about on another video. Menopause symptoms. Okay, this is a good one. Oxygen pump. That's cute. Is that your little doggy? I've got a shih tzu. I love these little doggies. They're cute. Menopause symptoms. Please could you help me advise for women going through menopause? I would definitely work with the endocrine glands here. Female reproductive formula is good for menopause. Always find hypothyroid cases, so you want to work on the thyroid. Definitely work on the parathyroid. Make sure they're utilizing calcium so they don't get so much cramping. So work in the thyroid, parathyroid. Pituitary head honcho, that's the gland responsible for shutting and turning on the female organs. So, you know, work on the endocrine glands. The female reproductive formula is good for that. Pop up the thyroid there. Check your basal temperatures under your arm. See how cold you are. And then keep working on your lymph system. You know, always work on that behind all these things. But on top of that, the female reproductive, pop up your thyroid, parathyroid with a glandular if you want.